Hi, my name is Leanne. I'm a registered nurse here at Southern Hills, and I would like to take you on a tour of our labor and delivery unit. This is our waiting room where you will find a locked door here. We have a closed system, so we monitor who comes in and out of our area. So when you come in, just feel free, ding on the doorbell, and we'll get you started. So let's go ahead and take a look. This is our check-in desk where you'll take a stop, sign in, and then we will get you on the way to labor and delivery. Let's take a look. At Southern Hills, we have 8 labor rooms, we have 2 ante rooms, we have 2 ORs, and our NICU is located on this floor as well. Good morning. How are you today? So here we are on our way. All of these rooms along here are labor rooms, and it just depends on who is here and how many patients where you will be placed. This is our nursing station where you will find all of our wonderful nurses. You can see we have monitors to monitor you and your baby. And let's head on in to our first room. Welcome to our labor room. This is a typical labor room here at Southern Hills. This is one of our largest rooms, and we have everything that we need inside this room. We have our labor bed where you will labor and stay in this room until you have your baby. We also have our baby warmer where your baby will stay with you. At Southern Hills, we believe in rooming in, and babies stay with their mothers as much as possible unless something warrants a trip to the NICU. So, let's take a look at this fabulous bed. This bed is able to go up, it can go down. It can go into different positions if you're trying to do a natural delivery. When it is time for delivery, our special bed comes apart just like this, and the doctor can slide right in there, and we have the stirrups, and you are all ready for delivery. After delivery, when you're all put back together, we put our bed back together, and we get to start our recovery. Your recovery will last 2 to 3 hours, and you will stay on the labor and delivery side for that amount of time. If you have a C-section, you will also recover in this same room for 2 to 3 hours. The great thing about these rooms is that every room has their own set of windows. You are able to open and close the windows as you need. In addition, each room has their own private bathroom. The bathroom does have its own private shower and facilities. You don't have to share with anyone. All right. So in this room, everything will take place with your baby as far as bathing. Any immunizations, any shots will happen right here unless we have to transfer your baby to the NICU. Let's take a look at where the NICU is. The NICU is a very short distance to all the rooms on our labor and delivery floor. So with the NICU, it is also a locked unit. Just as coming in the front door, the NICU is a locked unit where you will have to buzz in to go see your baby. Also on this floor, you will find our OR suites. Just down the hall, we have 2 OR suites, so if you do need to have a C-section, you do not have to go far, you just stay right on our floor. So let's keep taking a look at what we have. On the labor and delivery floor, we do have a pantry. In this pantry, you will find all that you need as far as water, ice chips, coffee, refreshments that the patients may need. You are free to access this at any time. As we move right around, we will find that we are heading over toward postpartum. On the way to postpartum, you will find that we have a larger waiting room where families can rest, take a little break, or just hang out until the time comes for delivery. All right, let's head on over to postpartum. Welcome to our postpartum room. You will be staying over here for the rest of your stay, which for a vaginal delivery is typically 24 hours, or a C-section, which you will stay for 48. Those are just minimums, and that might change depending on your doctor and your insurance. You will see that our postpartum room is very similar to our labor and delivery room. The only thing that is missing is the baby warmer. At this point, your baby should be able to go in an open crib and room in here with you. Also, we have our visitor chair, our daddy chair, or significant other chair that folds out into a full-size bed. You are welcome to have guests come to visit you, and you may have one person stay with you overnight. Each room does have their own flat screen TV, their own private bathroom, and of course your windows for a room with a view. Let's take a look at our bathroom. Each bathroom has a storage area, a toilet, a private shower, and a sink for freshening up and feeling like a new woman. In addition, we do have some storage areas, we have some dressers, and of course our flat screen TV. If you have any questions, the great thing about postpartum is that you can ask your nurse, and it is like a 24-hour training session. A time for you to ask questions. Is this normal? Babies, don't come out with manuals. So a lot of things you're like, is this normal? Is this normal? I'm not sure. Let's ask the nurse. And that's why our nurses are here to help you out during this period of transition. So, let's take a look at one other special spot we have here on our women's services. This is a special room that your families and your visitors can come take a rest, come take a visit, or may just need a timeout. It is called our family lounge. In our family lounge, we have snacks, we have a TV, we have sitting area, we have a restroom. So you are able to access this family lounge when you are on labor and delivery or when you come to postpartum. This is a great room for people to congregate and start celebrating the joy of your baby. All right. And so the great thing about the women's service area is that you may have your visitors come 24/7. The only thing they need to do is check in at our front desk and check out as well. Thank you for coming on the tour. I know that you have a lot of choices when it comes to choosing a hospital, and we here at Southern Hills would love the opportunity to deliver the best care possible to you and your family. If you have any questions, please give us a call. You can either comment on Facebook, or you can call the Labor and Delivery or MI unit to help get your questions asked. Have a great day.